Good afternoon. Welcome. I want to welcome you to this conversation. In conversation, two leaders on the front line of health equity, an interview with Dr. Uche Blackstock. If that's not what you were coming for, now's your chance. I'm Rich Besser. I'm president and CEO of the Robert Wood Johnson Foundation. I have been looking forward to this conversation literally for over a year. I had hoped that we would have done this last year, and I'm so glad we're able to do it this year. The way the session's going to run, I'm going to introduce Dr. Blackstock in a moment. She's going to share a little reading from her book. We'll have some Q&A, and then there'll be plenty of time for you all to engage and ask your questions as well. Dr. Uche Blackstock is a physician and thought leader on bias and racism in healthcare, the founder and chief advisor of Advancing Health Equity, which helps organizations take meaningful action to address bias, improve workplace culture, and ensure equitable care. As you'll hear from Dr. Blackstock, reading from her New York Times bestselling book, Legacy, A Black Physician Reckons with Racism in Medicine, she and her twin sister, Oni, followed in the footsteps of their mother, Dr. Dale Blackstock, by graduating from Harvard Medical School. The first mother-daughter legacies there. Dr. Blackstock lives in Brooklyn with her two children. And with that, Uche, let me turn it to you.
Thank you so much, Rich. Okay, can everyone hear me? Great. Thank you so much. And just FYI, I'm going to be sipping water because I don't know about you, but my mouth is so dry, right, with this altitude. Okay. When I was a little girl, my twin sister, Oni, and I used to visit our mother at work. Her name was Dr. Dale Gloria Blackstock. And in the 80s and 90s, she was an attending physician at Kings County Hospital Center, one of the public hospitals in Brooklyn, not far from our home in Crown Heights. Our mother worked long hours at her job, and so sometimes we'd head to the hospital after school to see her and do our homework. Walking down the disinfectant-scented hallways, our shoes squeaking on the linoleum floors, we'd make our way to the large echoing cafeteria, where we'd pull out our textbooks from our backpacks and settle down to work alongside the physicians, nurses, technicians, and aides taking a break. The staff behind the counter knew us well, especially because we strongly resembled our mother, and would smile warmly and ask, "Visiting your mother today?" After homework was done, we'd sneak into her clinic to ask her for small change for our favorite red Jell-O. She'd hand it to us, and if we were quiet, let us stay and observe for a minute or two as she examined a patient. Our mother was warm but serious with those in her care. Occasionally, her face would reveal a smile, but more often than not, she was extremely focused on what they were saying and what was going on in their lives. After all, she'd grown up in the same Brooklyn neighborhood where the hospital was located. The daughter of a single mother from New Jersey, raised on public assistance, she'd become the first person in her family to graduate college, Brooklyn College. And after graduating from Harvard Medical School in 1976, she'd returned home to her community. At Kings County, she wasn't just taking care of her patients, she was tending to her neighbors. In her interactions with them, she always seemed to know as much about their children and families as she did about their respective medical problems. When you came in for a visit with Dr. Blackstock, you weren't only having your blood pressure or cholesterol checked, you were also meeting with someone who was going to assess how your whole being was faring. I believe our mother practiced what is now known as structurally competent and culturally responsive care, which means the entire complex nature of the patient's background and the social context in which they live, work, love, and pray is considered during her evaluation. And her patients loved her for it. She was always bringing home little gifts from them, a knitted shawl, homemade cookies, tokens of appreciation. My sister and I were only 19 years old in 1997 when we lost our mother to leukemia, and she was just 47. She died too young, but by then her indelible influence had rubbed off on us. Her passion for learning, her dogged perseverance, and her commitment to serving her community heavily influenced our own decisions to become physicians. Oni and I both graduated from Harvard College and then attended Harvard Medical School, the school's first Black mother-daughter legacy graduates. Like her, we both went to work with historically underserved populations after graduating. My sister at Montefiore Hospital in the Bronx, while I went to train at Kings County in Brooklyn, following in our mother's footsteps. In the years since then, I have felt her by my side in so many of my own interactions with patients. Her ability to listen to and her truly care continues to be a model for me, and it's something that our patients are crying out for now more than ever. Thank you.
So for later, here is the cover of the book. But one of the things that I said to Uche before the session, I listened to the book. So if you enjoyed hearing Uche's voice with these words, I would encourage you greatly to buy the book, but also the audio that goes along, because hearing her tell her own story was really, really powerful.
Thank you.
So I wanted to talk about your career, your path, talk about the moment that we're in. But your journey is really, really informative to the rest of that conversation. You talk early in your book about privilege, that you felt that your life growing up in Crown Heights, Brooklyn, was one of privilege. And there you quoted Marian Wright Edelman early in your book in saying that you can't be what you can't see. And I was really struck by the descriptions you had of growing up in Crown Heights.
Yes, I mean, I feel, so this is Crown Heights pre-gentrification. This is Crown Heights in the 80s and 90s when, it's the height of the crack epidemic. So I know probably for some people in here, they're like, why do you feel privileged to grow up in that environment? I felt privileged for multiple reasons. One, growing up, I thought that every physician was a Black woman. And that's because of, not just because of my mother, but she would take my twin sister and me to meetings of local physician groups and bring us into the room, and my sister and I would sit in the back of the room, trying not to make any noise, but listening very intently to these brilliant women talking about essentially what's we call health equity now, but talking about projects for our community and really working in service to our community. And I just feel like to be able to have that experience, it wasn't until I got older that I realized that it was not the reality, but it was my reality. And I think also growing up in a neighborhood where we all really looked out for each other. If you're from New York City, you may know about alternate side of the street parking. It's this horrible parking policy where on certain days of the week you can't park on certain sides of the street. There was always going to be someone to let us know if we didn't move our car. There was always going to be someone to know if we needed to shovel or would help us shovel our front yard. But all that to say is that I grew up with the lesson I learned from my mother is that it doesn't matter where you go. You can go to Harvard Medical School, but you can always come back, and you should always come back. And so that's the lesson that I learned, not just from my mother, who came back to not only train, but practice in the community that she grew up in, but that's also the lesson I learned from so many of her colleagues and the other Black physicians in my neighborhood.
Mm-hmm. You talked about leaving the community to go to Harvard Medical School, and I wanted to see if you could share some about that experience, because I would imagine your belief that all physicians are Black women was challenged a little bit when you got to Harvard.
Yes, no, definitely, it was. But I feel like my parents really laid the groundwork. I mean, it's interesting because in the acknowledgement section of my book, when I was recording the audiobook, the sound engineer, she said, I've never seen someone with so many acknowledgements. And I said, oh, it's just because all of these people are the reason I am where I am today. All of these people. And part of it was, I talk about the nursery school that I went to that's over 45 years old called Little Sun People. It's one of the first nursery schools in the country. It's in Brooklyn that has a culturally responsive curriculum, and it's very Afrocentric. But my parents and this exposure I had growing up really laid the groundwork for me to go to Harvard Medical School, because even when I got there and I didn't see other people that looked like me, I still had a very strong foundation and understanding of who I was, what I needed to do, what were what was my purpose. And even though I didn't know exactly what I was going to specialize in, I always knew that I would come back to my community in some form. But with Harvard Med School, it's known for, in the 70s when diversity initiatives started after MLK's death, it's actually one of the most diverse medical schools. There's a huge Harvard Medical School Harlem Hospital pipeline from the 70s. So when you go to Harvard Med School reunions, you see a lot of older Black physicians who had that pipeline. And so going there, obviously it was a shock not to see the diversity among my attending physicians, but I knew that I was there to get my education and to take that and do something good with it.
You mention in your book, you talk a fair amount about the imposter syndrome. You talked about it in terms of mentorship of others. Was it something you experienced in the same way as some of your other classmates, or was your grounding such that you didn't have to go through that?
I know, that's such a great question. And I'm just curious, anyone in here, even though I know imposter syndrome is human-made, has anyone felt that? Right, exactly. So I would say even despite this really this foundational upbringing that I had, I think it's almost impossible not to absorb cultural messaging, right? About do you really belong? Are you good enough? And so even though I did have these amazing role models growing up, being in that environment. And even though I was more privileged because I had a parent that was a physician, it still sometimes felt like do I really belong? And to be honest with you, I feel like that about medicine still.
Say more.
Yeah, I feel like, and part of it is my journey. I felt like just the environments that we're in a lot of these institutions, and we probably will get into this, but I feel like I could not really be my authentic self.
Mm-hmm. Mm-hmm. So you went to Harvard Medical School, pursuing an academic career.
Yeah, I thought I only knew academics.
Yeah.
For me, academics, for people who aren't familiar with having an academic career in medicine, it's considered the best of the best, right? You're doing clinical work, education work and research. Probably only a small percentage of physicians actually go into academics. Mm-hmm. It's considered very elite.
Right.
And so I thought, for me, that's all I knew, and so I thought that was going to be my marker of success.
Mm-hmm. And where did you go to pursue that?
I went to NYU School of Medicine, and I was actually really excited to go there because one of the godfathers of emergency medicine, his name is Louis Goldfrank. He's chair there. He was chair, and I had always been in touch with him as a resident. He was like, well, we would be so excited to have you. But one thing I noticed when I got there is that I was one of 2 Black faculty in a department that serves a very diverse emergency department in the middle of New York City. And so obviously I noted that, and even though my colleagues were all very kind and warm to me, I still noticed, am I the only one that notices that I'm often one of one or one of 2? Mm-hmm. And that our faculty body does not reflect our patients.
Mm-hmm. And you were in the emergency department, mm-hmm. and then you were in the Department for Diversity, Equity, and Inclusion. Was that at the same time, or was that a transition?
So the first 7 years of my career, I was mostly in medical education. So I did a fellowship. Oh no! Oh, sorry. Hope it's just seltzer water.
The emergency physician
yes,
in you.
I know. I'm do I need to get okay? For the first 7 years, I did mostly medical education. So I did a fellowship in emergency ultrasound. And so I developed a 4-year curriculum for their medical school using bedside ultrasound as an adjunct to teaching anatomy and physiology. I started our department's first emergency ultrasound fellowship. So I think by all appearances, I had multiple roles and titles. I seemed very successful. And because of the work I had done in the medical school, I was handpicked for this diversity role in the Office of Diversity Affairs. It was Director for Recruitment, Retention, and Inclusion. And part of the reason the role was created because there was an AAMC faculty engagement survey that had been done showing that especially women faculty felt like there were differing experiences around promotion and mentoring and sponsorship. So I was appointed to this role. I was so excited about it.
So, one of the things that comes through clearly in your book is issues of racism in the settings that you're in, but also sexism, and the intersectionality of that as a Black woman. There's description of the minority tax that occurs in academia. Can you share a little bit about your experience with that?
Sure, and while we're on that, I also want to talk about pet to threat. And are people familiar with the pet to threat syndrome? But I'll do pet to threat first, just because it does happen at the intersection of racism and sexism. So who's heard of pet to threat? So it's actually a phenomenon that's been described by the psychologist, Dr. Keisha Thomas. And she talks about this phenomenon of women of color being hired by an organization, right? And the organization is super excited to have this person. They you're so amazing. We're very excited to have you. Once you come into the organization, given your lived experiences and professional experiences, you start noticing things, right? Like that need improvement, right? Certain inequities or biases. And then you mention it. You feel empowered to mention it because everyone's treating you well. And so you mention it, and then you start to be a threat. So you go from being the class pet to the class threat. And when you start mentioning these observations that you're making, either you're told you have to leave, or they make things so difficult for you that you end up leaving. And I think this phenomenon is something that I feel like I went through, where I was appointed to this role, handpicked for this role, and then once I started talking about things and efforts and initiatives that we needed to do or things I was noticing, I was actually silenced and muzzled in that role. And it was incredibly demoralizing. When I think about it, I get really emotional about it because I was for the first time really excited about doing this work that I thought would benefit our students and our residents and our faculty. And instead of being empowered in that role, I was silenced.
You created a newsletter.
Yeah, I created a newsletter.
You want to share that story?
Yeah, for women faculty, because I said I want to make sure we are promoting all of the wonderful work that our women faculty are doing. Nothing too radical. I mean, it wasn't too radical, but it was let's profile women faculty. And I was told that we couldn't do that because it would be too exclusive of men. It wouldn't include men. I know. So yes, so it was just I realized, and it was interesting because I realized my values were in misalignment with the administration's values, right? Because if they really understood, they would know that we do have this leaky pipeline for women faculty, right? That we do have a lack of mentorship and sponsorship for women faculty, and that even this little, token of appreciation could make someone just feel a little bit more appreciated.
When you were at Mount Sinai,
NYU.
I'm sorry.
Sorry. Sorry, Mount Sinai.
Mount Sinai is a sponsor of this conference, so they're stuck in my head.
Yes.
Yeah, that's the problem. The brand is there. So there's a challenge in healthcare in terms.
Okay, but before minority tax, do you want to talk about minority tax?
Yes, please.
Okay.
This is great.
But I also wanted to say. But I also want to say about the pet to threat and then minority tax is, for me, I got to this point where I felt really undervalued and very underappreciated. And I think if someone's looked at my CV, I actually had to look at my CV while I was going through this, because I was wait, did I not am I imagining things? The other thing is I went up for associate professor, and my department unanimously voted me up. There's Uche, you are going to be a shoo-in. You've done so much for the medical school. You've published. And actually, my promotion was denied the first time. And I was so devastated because I said, oh my gosh, I've done all of this work. And I had done so much on my own without any mentorship. And actually, if you look at the data, it's something that's very common for faculty of color to be denied promotion initially. And so I was just oh my goodness, I was doubting myself.
Yeah.
It was really hard. And then also, I was doing work that I felt like was not valued. So in the book, I actually have a chapter about a medical student that I mentored. Her name is Natasha. She's from, her family's Jamaican, but she grew up in Newark, New Jersey. She's first generation. And I talk about my relationship with her and also what I learned from her. She had actually done so much work for the school. The class below her had one Black student in it out of 165 students. So she got together, she was a second year, she got together with her classmates and they started these interview programs, recruitment programs, using their own time. And they single-handedly increased the number of Black students from 1 to about like 25 in the next class, which is amazing, right? But it was so exhausting for her, right? That extra work that she had to do. That once she finished medical school, she told me, and we're still in touch, she's actually an adolescent medicine physician now, but she said that starting in residency, she stopped doing or volunteering for any diversity initiatives. She was done and tired, and that broke my heart. Yeah. But also the other piece of that fact that I felt like the mentoring that I did, like there's all of this informal mentoring that wasn't really counted as valuable towards promotion.
Right.
Right, and it's really this emphasis on publishing, on getting grants, but there's also this intangible work that you do of providing support to your students who come to you because they know that you get it.
Yeah. Why does it matter that we have a diverse medical workforce? I mean, is it just a nice thing that people get opportunity, or is there more to it than that?
Yeah, so I love this study from the Journal of American Medical Association that came out, I think it was about 2 years ago. It showed that having even one Black primary care physician in a US county increased life expectancy for not just Black people living in that county, but everyone. The sad part is like less than 20% of US counties have even one Black primary care physician. So that's just like a little bit of data. We know that for patients of color, that actually racial concordance in care, it actually makes a difference. It makes a difference in terms of whether people take their medication, whether they follow the physician's recommendations. And the other piece is that we are more likely to go back to our communities to practice.
Can you share the story from COVID when you were seeing a patient and you were wearing full protective gear?
Yes. So, I feel like I've had these moments that reinforce for me why the work I do and the advocacy I do is so important. So the thing is I didn't talk. Okay, yes. Yes. Okay. So I made the decision. Okay, I'll get there. So I made the decision. I to leave my academic job in December of 2019. And people looked at me like I had lost my mind because, I was an associate professor by that point. I did get promoted eventually, and I had multiple titles and roles, but I actually felt really, like I said, undervalued and underappreciated and almost invisible. And so I made this really difficult decision. I said, I'm going to leave. I'm going to focus on an organization, my own consulting firm, Advancing Health Equity, and then work part-time in urgent care. And that was December of 2019. Yes.
Good timing.
So I was like, okay, this is great. I'm going to work at an urgent care in my neighborhood in Brooklyn. I'm going to work part-time on my consulting firm. This is perfect. And I'm not going to have all of these other responsibilities. And then the pandemic hits. And I'm in Brooklyn. We're the epicenter. And I want to say, within the first week of the pandemic, I could see my patient population browning. And so I actually wrote one of the first op-eds in the pandemic on racial health inequities. I wrote about what we were going to see and why we were going to see it. And one of the patients I remember seeing during those first few months, I walked into a room, and at that point, I literally was seeing about 100 patients per shift on a 12-hour shift because people were too afraid to go to the emergency department, so they would come to urgent care even if they were very unwell. And so I walked into the room, and at that point, there was so much we didn't know about COVID. I was covered literally head to toe in PPE. I had even shoe covers on. I had 2 hair bonnets on, face shield, double mask, everything. And so I walked into the room to find this young Black woman sitting on the exam table. And when I walked in, her head was in her hands. And she looks up at me. And I say, "Hi, I'm Dr. Blackstock. How can I help you?" And she says, "Can I stop you for a moment?" I said, "Sure." And she said, "Are you Black?" And I said, yes, I am. And she let out this deep breath and said, "I'm so glad, because I know you'll listen to me." And in that moment, I felt proud to be the doctor she needed, but it also made me feel really sad that she had had interactions where she felt like she had not been listened to.
Yeah. I'm watching the clock and all the questions that I still want to ask, and recognizing we're going to come up against it. So I want to get to your current work, advancing health equity. And last night, the big idea you were lifting up was around a tool, a way of really looking at equity. And I want to see if you could share some about that, and then I want to talk about the current moment.
Okay, sure, no problem. And so I just want to tell you that, so I'm going to just give a shout out to Andre Blackman. He is in the audience, who's been a dear friend, but also an advisor to me, like since I think 2018 we connected, 2017. But when I founded my organization, my consulting firm, Advancing Health Equity, he helped me so and continues to help me. So thank you so much, Andre. So I was going to say that I'm a doctor. I'm not I guess I'm an entrepreneur by default. So I've kind of learned along the way, but I knew just based on my own experience in academic medicine that I needed to create an organization that could do the work from the outside. Because I knew that working from the inside for me, and this is not to say you can't work from the inside. I think it's also a deeply personal decision. But for me, I know that my place is on the outside, and that's how I can have the biggest impact. So I founded Advancing Health Equity because I said organizations in healthcare and public health, they just need so much work in terms of how do you operationalize equity, right? And so we started out, it was just me with trainings, and now we do organizational assessments around culture and equity. And the thing I'm most proud of now is that we offer strategic counsel. Mm-hmm. And so we know that this work is not just about one training. We know this work is really about sustainability. And so we vet the organizations. Like, why do you want to do this work? Mm-hmm. Who is doing the asking? Do you have buy-in from leadership? Right? What is your plan going to be? What precipitated this work? And I would say in 2020 and 2021, we know what precipitated a lot of those requests. Yeah. And from medical schools, it was a lot of demand letters from students. Some students actually, they named me, they said, "We want to work with Dr. Blackstock." But what we see now in this moment is that we are pivoting in terms of the work we're doing. We're still doing strategic counsel, but we're also thinking about how can we support leaders who are doing health equity and DEI work in healthcare and public health. Like, how can we give them a space so that they can speak freely about what's happening and it's confidential and private and we can advise them? Yeah. We're also thinking about how can we support organizations in this moment that are trying to figure out, like, what language do we use? What kind of work can we continue to do? So that's really how I see us partnering with organizations to continue to do health equity work, because I think this work is more important now than ever before. And one of the questions was going to be, I don't know if it's still a question, but like when Legacy came out in 2023, January 2024, the difference between January 2024 right. and today, yeah. For me, the difference is that we're doubling down on this work is more important than ever, because we know that health outcomes, Black maternal mortality is not improving, right? We know that these are the far-reaching impacts of racism, economic inequality. We are seeing it. And so I'm not shying away from that. I think you may have wanted to ask about like just being someone that's so vocal or with exposure in this in this landscape. I don't feel a lot of pressure because it's something that I feel passionately about, but I do expect my colleagues and allies who also are concerned about this work to also have my back.
Yeah. So, your organization, Advancing Health Equity, And we're seeing the word equity has been, it's on the list of words you can't use if you want to work with government. It's on the, you're seeing every other word to describe it except the word.
Right, and to be honest with you, like, I have not thought a moment about changing the name of our firm, because we still want to advance health equity. But I think about, something I mentioned yesterday in the big ideas is that everyone can get on the same page about quality, right? Everyone can get on the same page about making sure our patients are getting the best care possible and have the best health outcomes. That's really the work that we're doing. So if we want to call it quality improvement.
Yeah. Do you make the economic case for it?
You know what? If I have to, I do. But I feel like there's a moral case for it.
Yeah.
First and foremost, and that's what moves me. Although I always talk about this, Commonwealth Fund. I think one of the underwriters here, they do such wonderful health policy work, and they really are. They do a lot of research comparing us to other high-income countries. And when you look at indicators of well-being, like life expectancy and maternal mortality, we are doing so poorly compared to other high-income countries. Right. And we spend so much more, right?
Yeah.
So yes, so I think from that perspective, yes, you can make that case that we would actually spend less if we took care of people and had more preventive care. But at the same time, just what drives me is the moral obligation I feel like we have for making sure that people are getting the best care possible.
Terrific. Well, unfortunately, I have to stop asking my questions, and I have to share that opportunity. So if you have a question, raise your hand. There will be microphones circulating. I'll try and work different parts of the room. I saw your hand here.
And then I'm happy. I just also want to share about my book journey, about becoming an author.
Go for it.
I just wanted to share this because...
And then we'll come to you in the front.
Yes, don't worry. No, just the lesson learned, because if you had asked me 5 years ago, would I be a New York Times bestselling author, I would say, what? What are you talking about? Would I have written a book? I had no plans to write a book. But in 2020, I was on, so part of the work I did, writing op-eds about what I was seeing in the pandemic led to actually my media career. I became an MSNBC medical contributor. And I saw that role as more of advocacy, really connecting with our community, making sure that we were putting out responsible, accurate messaging. For many of them, it was the first time they had seen a Black physician. And I had people message me to say, I got vaccinated because of you. I sent my children back to school because of you, right? So I saw that importance. And so I also was doing radio shows, and my literary agent, Niti Madan, she had been following me on social media, and she was listening to me on a local NPR show in New York City called The Brian Lehrer Show. If you haven't listened, it's wonderful. He's a treasure. And she just cold emailed me and said, have you ever thought about writing a book? She said, I think you have a story to tell, and you're the only person to tell that story. And so I say that because I was just doing the work that is important to me. I was finally in alignment. Like, once I left academic medicine, I actually felt unburdened. I actually don't want that for other people who are in academics. I want them to stay in academics and feel unburdened. Now, that is aspirationally the goal, but I felt so unburdened. So all that to say is, do the work that is important to you, do the work that aligns with your purpose and your values. The people who see you will see you. Okay.
Terrific. Question for Dr. Blackstock. Raise your hand here in the front.
Hi, my name is Juanita Chin. I'm a sociologist and demographer. My question is twofold, and it can seem it's not fully my point of view. So we talk about health equity and racial concordance between practitioner and patient, and we see the results and the meaningful impact at the population level. The stories that we give and the examples that we use are at the individual level. At an individual level, just because someone looks like they would believe in health equity doesn't mean that they share those views of the importance of health equity. How do we provide interventions at the institutional level that will take the burden that you discussed off of Black providers, but also not hold Black providers responsible for the care, because they may actually have no interest in it?
Yes, and I think you're right. I talk about, actually, at the end of the book, I have a call to action, and one of the call to actions is to Black physicians, saying that we trained in institutions that actually excluded us, that use a Western biomedical model, and we also absorb some of those own biases that we may use against our patients. So I don't expect just because you're a Black physician that you're going to be interested in this. But I think some of what I talked about yesterday briefly with my big idea is really like thinking about how do you measure impact, and how do you hold not just physicians but systems accountable. And so looking at how patients feel like they're treated and supported, right? But also combining that with the expectation that we expect all clinicians to deliver quality care. It should not be just up to physicians of color to do that. So thinking about how do we integrate that into our systems, right? What are metrics that we can look at? And I also love the idea of really involving patients in this, right? Like what to them is considered success? What in terms of a positive patient encounter, and then aggregating that data and holding systems accountable, like actually measuring it, intervening as needed. So yes, I think that we talk about a lot of these examples on an individual level, but I think we need to find systems way, like the Equity Vital Signs Index I talked about yesterday, of holding systems accountable for that.
On this side, in the front.
Hi, Audrey Davis, Cancer Support Community. In the beginning, you mentioned privilege.
Speak up.
Sorry, in the beginning, you mentioned privilege. You also touched on allies. I'm wondering about any calls to action that you have for those allies in the room who have privilege, either racially, socioeconomically, in terms of their gender, et cetera, and what you might ask them to take away from the session that they can.
Yes, thank you so much for that. And I just also want to give a shout out to the Cancer Support Community, and I've done some partnerships on social media with them, and they do a lot of really great peer-to-peer education for Black patients with cancer. So thank you so much. Yes, my call to action, and actually, and I have it in the book as well, is that you cannot do this work alone. We really need people who have privilege, different types of privilege, to speak up. Whether it's like within an institution, whether it's on a policy level, we need everyone to be doing this work. And I think first, listening to what the concerns are or what people need support with, and then asking how, is this a way that I can help? But I really think that there is a moral obligation for everyone to do this work. When I think about why I wrote Legacy, it was for a broad audience. First, it really was to affirm the experiences that Black patients and physicians have, but also it was to sort of break things down in a way that a broad audience could understand why these issues are important. And that's why I ended the book with a call to action, because I think often after reading, people are like, what do I do? And it's like, you can support Black-led organizations in your community, right? You can support Black leaders who have similar values as you, in terms of elected officials. You can support policies, speak up on policies that would benefit communities of color. So there are all different ways that you can make a difference. I also say that sometimes the issues seem very overwhelming, so look hyper-locally or locally. I talk about in the book about a birthing center in Minneapolis called the Roots Birthing Center. It was founded by a Black midwife, and they've been actually able to publish studies that show that because of their model of just providing respectful and dignified care, they've been able to improve preterm deliveries and improve maternal complications. So, think about like what's going on in neighborhood adjacent to you, because we know that literally within blocks of probably where you live, there are differences in how long people are living for and the care they receive.
Any questions? I'm looking in the back just so I don't miss in the back, but down here in the front.
Oh, but there is someone back there, and then we'll come to you, I promise.
There is someone in the back?
Yeah, it's right there.
Ah, there we go. And then we'll come back towards the front.
Hi, my name is McKenna Jervis. I'm actually an incoming second-year medical student.
Oh, I spoke to you yesterday, right?
Yes.
Okay, yes.
So I think this is a very interesting conversation just based off of the experience that I'm currently in. I loved what you said about you can't be what you don't see. So I guess what would be a tangible step that you would give to either someone in medical school, going into medical school, physician in their career, of how they can, quote unquote, see, right, expose themselves to these inequities so that they can actually make tangible work?
So I will say that there are a lot of really wonderful Black-led organizations out there that are doing very important work around mentoring. So the National Institute of African American Health actually offers physician mentors to medical students. But when I think about my journey, I wish I had been a little bit more assertive in looking for mentors earlier on. That's one thing, but I also think that there is value in cross-racial mentoring. And I write in the book, actually, one of my biggest supporters at NYU was an older white woman in the Department of Internal Medicine who was there for me every step of the way in terms of advising me, mentoring me, and I think a lot of it is because she also had gone through some similar experiences as well. So cross-racial mentoring, I also ask faculty, not just faculty, but people in leadership positions to recognize that, a young person can't get all they need from one person, but I also encourage everyone to consider mentoring cross-racially.
Down here in the front, we've got...
It was in the pink and then Yankees jersey.
Perfect.
Hello, and thanks for being here. I'm State Representative Naquita Riggs from Colorado, so welcome. So COVID really exposed the inequities when it came to healthcare, especially in Black communities. Mm-hmm. And we have struggled with maternal health care as far as for Black patients specifically. Is there more that we could be doing legislatively to help in those areas?
Yeah, I think as it relates to maternal health, the Momnibus bill has literally been in Congress for several years, and it's been stalled there. And so, we all need to be writing our legislators to encourage them to support pushing it through. But what I love about the Momnibus bill is that it's very multifaceted, right? It knows that just by increasing diversity in the perinatal workforce is not going to do enough. So it addresses social determinants of health, talks about using telehealth to improve outcomes. And, there's a role for doulas. And so there's not just one solution because we recognize that there are many different layers to the problem. So that's one area and one thing that I actually write about in the book that I think that we could, if you're looking for ways to advocate, it's really that Momnibus bill. Oh, yes, Yankees.
Hello, my name is Chase, the founder for Sanico.cloud. I'm also a journalist and also proudly Nigerian descent. Knowing that you're Nigerian descent and also...
No, just my name,
okay,
but I'm honorary Nigerian.
Okay.
Thank you.
Honorary Nigerian, if you were invited home to do some...
Yes, I would come.
Public health, would you be willing to do
I would see what my bandwidth was and let you know.
But truly,
yes.
Looking at your conversation yesterday when giving you a big idea, and for some tech founders, health fellows who are in the house right now, if you were to provide support or collaborations, how would you approach tech founders who are currently building applications for menstrual, menopause care?
Yes.
What do you see differently, and what would you think people should use technology to do?
Yes. Oh, thank you so much for that very important question because, I don't think technology is necessarily the panacea. I think we'd have to be very thoughtful about how we use it. So one study I think about is a study that was mentioned in Science or described in Science a few years ago. I don't know if people remember this. It was an algorithm that an insurer was using in terms of allocating resources to chronically ill patients. And because of the data set that was used, because it wasn't thought about in a very thoughtful way, the algorithm actually allotted fewer resources to Black patients who were sicker because the algorithm and the people that were developing the algorithm didn't account for barriers to access, people accessing care, right? And it wasn't that Black patients were necessarily underutilizing the system. They just didn't have access, right? And so when I think about all of the promise that can happen from tech and different platforms, I think about the importance of really having an equity focus and an equity lens when developing these products, thinking about what is the potential for to support, and what's the potential to harm, and what is the magnitude of that. So I think that I would love just more thoughtfulness on how we use tech in a responsible way, because it could potentially perpetuate, and we've seen it, it would potentially perpetuate the inequities that already exist.
There was another question down here in front. You're good? It got in. All right, so I'm going to kick back to another question.
Yeah, sure.
Yeah, so
Okay.
because there's two things I want to get to. One is related to the moment that we're in. And we're seeing across so many different sectors retreats from commitments to equity, diversity, and inclusion. You and your sister posted on LinkedIn a really powerful letter to Harvard Medical School. And Harvard's been getting a lot of positive response lately because they push back on the assault to the university. But it's not so easy.
So I would say this. So my sister and I, we felt, obviously with the platforms we have, and as alumni, we needed to. We wrote a letter to the current Harvard Med School dean and the other deans, because we got a letter saying that they had changed the names of their Office of Diversity Affairs. It actually no longer were supporting affinity groups. There were some other things that were happening, and we just felt like, the larger university has said, like, we're not going to capitulate as much. And so I'm like, Harvard Medical School, why do you have to go on this other way? And actually, to me, it's not surprising, because I feel like medicine in particular is particularly sort of reactive. I think we like to think of ourselves as innovators, and some people are, but the institutions, they move very slowly, and they also respond very quickly. And so I wanted to make sure that, we haven't gotten a response yet, but I wanted to make sure that they knew that what the proper way was to go about it was to get input from students, which they didn't get from alumni, just to get more input from us and to say that we expected better. And so I know that institutions are scared, but we really need leaders to be leaders. We need, so if they're not going to stand up, who's going to stand up? Yeah. Like, it can't just be me. It can't just be you.
Well, when I saw that posting on LinkedIn, one, I thought it was so important to hold an institution like Harvard Medical School accountable, but it models for everyone else who's reading that the importance of us each holding the institutions accountable that we're connected to.
Yes, no, absolutely. Yeah. And again, I feel a responsibility to do that.
Yeah. So as we're about to wind down, in these times, are there things that give you hope?
Yes.
And are there things that give you joy?
Yes. So I will say that. So legacy is like my fourth baby. I have two children, two human children, and then my advancing health equity is my third baby, and this is my fourth baby. But this really is a love letter to my mother, and my mother's legacy gives me hope. Just thinking about everything that she had to overcome to become a physician, the impact that she made on our community, the impact that Black physicians continue to make. And that, in this moment, we really are leaning on each other. We know that this work is more important than ever before. And so what the community and the connection that I've seen in this moment is what gives me hope.
And joy?
Thank you. And joy? Okay, joy. Okay, let's see. Well, you know what? Actually, being here, going on our morning walk this morning, we went to what do they call the Maroon Mountains? Maroon
Bells.
Yeah, the Maroon Belts. Yeah, that was beautiful. Like, I needed that so much. I needed that so much after my suitcase got diverted to Los Angeles yesterday, which is why I gave my big idea presentation in gym clothes. But yes, just the joy to be able to come to an event like this, to be in conversation about issues that are very important to me, and then to be at one with nature has been wonderful.
Well, Dr. Blackstock is going to be signing her book, Legacy: A Black Physician Reckons with Racism in Medicine, in the Marble Garden tent from 5:15 this afternoon until 5:45. So if you want to engage with her, get a book, get it signed, you can go there.
And
the book
get
is
a picture also if you want.
Picture, there we go.
Sure.
And the book is also available for purchase at the event in the Aspen bookstore, which is in the main tent over there. Please join me in thanking Dr. Blackstock.
Thank you. Thank you, everyone. Thank you. Thank you.